Thank you very much.
Thank you, sir.
I hope you are able to see my slides. Would
Yes, sir.
someone
Yes,
confirm?
sir.
And just confirm please that you are able to see the next slide.
Yes, sir.
Okay, thank you very much. Uh, First of all, my apologies that I am not being able to present there myself in person. I would have loved to be there, but prior commitments here did not allow me to be present amongst all of you today. Secondly, I would like to thank the organizers and especially Professor Pranav Deshmukh for this opportunity to speak at this symposium on Bharatiya knowledge system. And thirdly, it's my enormous privilege to be speaking immediately after Professor Ram Subramaniam and Professor Mandem Srinivas, because both of them are highly learned scholars of Bharatiya knowledge systems, and I consider it to be a personal privilege that I am speaking immediately after them. What I would like to talk to you is about taking example of biomedical sciences in India through centuries. But the kind of narrative that I have been trying to generate, whether I am wrong or right, I don't know. But the narrative that I have been trying to propagate amongst the students is that the knowledge about human health and the medical system has been very old across different cultures around the planet. And this knowledge, there has been a definite way of sharing among many different cultures. Because India is a very ancient culture, our history is full of development in biomedical sciences, and European travelers have taken many of the clues from us to Europe to understand human health there. Now, this tradition of exchange of knowledge has existed till roughly about 17th or 18th century. And since then, when the colonialism took over, the sharing of knowledge rather became skewed. And in fact, we were told that ours was actually not based on the rational thing or whatever. And that's where the conflict between the East and the West really arose. And that's the kind of narrative that I would like to tell you today with evidences about what kind of knowledge existed in India about human health and in general about biomedical sciences. So what I would like to tell you to begin with initially is about the ancient practices in ancient India, medical practices, then how the healthy exchanges between European Indians took place on these practices, and what were the kind of learnings that European travelers took from India to Europe. And then I would come to the modern times in the last 100 years, that what are the notable contributions from India in the modern times, and then I will conclude, and hopefully I will not take more than about 20-25 minutes in all of this. So let me start from our ancient Vedic period, and all of us know that our four principal Vedas are Rig Veda, Atharva Veda, Samveda and Yajur Veda, and the four of them together describe roughly 300 medicinally useful plants. Right? So this is a very useful knowledge about medical plants in the Vedas themselves. And from there arise a few hundred years later, or maybe 1,000 years later, two ancient texts which are actually considered to be sacred in the medical sciences are the Charaka Samhita and the Sushruta Samhita. And the Sushruta Samhita talks largely about surgery and medicine, while Charaka Samhita describes many plants and other things. Now, according to ancient Indian wisdom, the whole world is made up of five essential, what we call elements, or Panchamahabhutas, the Prithvi, Jal, Agni, Vayu and Akash. All of you are aware of this. And the system is such that we maintain a balance among all of this. And our system of health also recognizes these five elements, and we say that a proper balance among the five elements has to be maintained. And at any point of time, there is an imbalance. What you would get is some kind of manifestation in a disease-like condition. And that can be recognized by three principal qualities that what we have associated with each person. called Vata, Kapha and Pitta, Vata, Pitta and Kapha, and I will not go into the details of this because this is not the topic of my lecture today. But what I would like to present to you now are based on these concepts that we have developed, what are the kind of archaeological evidences that actually confirm ancient Indian knowledge. And let us go to some of the archaeological evidences based on this. So the first of the archaeological evidences that I would like to present to you, and all of the work that I present to you has been peer reviewed in all the many visible international journals. This paper is from the journal called Nature, many of you are aware of this, in 2006. And what they had found out in roughly about 5 to 6,000 BC in Mehergarh, a few hundred kilometers north of Rawalpindi, certain skeletons that were excavated from Mehergarh. And in these skeletons, from 9 adults, they were able to identify 11 drilled molar crowns. And what essentially it means is that dental surgery in India at that particular point of time, that is about roughly 5000 BC, was quite common. And what they found was the drilling was essentially in the first and the second molar, and the holes were roughly about 1 to 3 millimeter diameter and about half to 3.5 millimeter depth. Now, based on this knowledge, when a few thousand years later, when Sushruta wrote Sushruta Samhita, he actually wrote the entire anatomy, the entire human anatomy, and in fact, he also wrote down procedures for doing on human body so that this can be actually done for correcting any of the abnormalities in human health. So this is the archaeological evidence, and this is full of archaeological evidences in the dental surgery from that period onward, and multiple people around the world have recorded this from the skeletons that they have found out from the archaeological excavations around. And there is a continuous tradition of that till even today. The second example that I present to you is for the exchange of knowledge between Europeans and Indian on medicinal practices, and I will give you a couple of examples on this. And to begin with, the first example that I would like to give you is on what today we call as the plastic surgery, or what has been known in the medical terms as reconstructive rhinoplasty. And the reconstructive rhinoplasty is explained in detail in Sushruta Samhita, and essentially what it says is that you take leaf of a tree, and if you have a nose which is amputated, then we place it on the nose, cut the leaf in the shape of the nose, and then put the leaf on the patient's cheek or forehead, and then a skin is actually excised out of that, is flipped, and the nose is reconstructed. Now this has been known, and for the first time Westerners saw the procedure being operated on an Indian patient was sometimes in 1793. In that period, the British East India Company, they had a camp in Pune, and they had gone an offensive against Tipu Sultan in Mysore, and a bullock cart driver called Kausaji, whose photograph is shown here. This photograph is taken from the Wellcome Trust Library in London. Kausaji was sent as a bullock cart driver to carry ammunition as well as soldiers from Pune to Mysore. And at that time his nose was cut by Tipu Sultan's forces. British of course lost the battle. Tipu Sultan eventually lost the battle to the British forces a few years later. But the 1793 battle, it was won by Tipu Sultan. And as soon as Kausaji returned to Pune, a reconstructive rhinoplasty was actually performed on him in Pune under a tree. And British medical officers and the soldiers gathered around that tree to watch that surgery with great intent. And eventually, about 20 years later, this particular procedure was presented in the Royal College of Surgeons by British doctors, what they had witnessed in India, and based on the account that what they had seen, the first reconstructive rhinoplasty in England, in UK, was performed on 22nd October 1814 based on the precise description of how it was done in India by a doctor called Joseph Carpew at UK hospital, in the York Hospital in Chelsea on His Majesty's Army Man. And Joseph Carpio is on record saying that the operation was reported to have lasted only 15 minutes, and the reconstructed nose had every appearance of a natural nose, and the forehead took 3 months to heal. Joseph Carpio also notes that, of course, the patient was under enormous pain because what was going on, which is understandable, but possibly one minor detail that was missed by the British medical practitioners was in India also sedatives or painkillers were used prior to the surgery, right? And most of these painkillers were essentially cannabis based. But I'll come to the cannabis story a little later. So this is the practice that was learned from India, was taken to the West, and today reconstructive rhinoplasty with minor modifications of what I have described to you is practiced in leading hospitals all over the world, including India. The same practice where instead of leaf, one actually reconstructs the shape of a nose, puts bamboo sticks in the nostrils so that the nostrils remain open, and a skin from the forehead or from the cheek is cut, flipped over the nose, and the nose is reconstructed. Exactly the kind of practice that was described in Sushruta Samhita is followed all over the world even today. Now, these are the kind of healthy exchanges between the West and the East that I was talking about, how we are all learning from each other's experiences on this. One of the first earliest examples of the exchanges between the West and the East was in the systemization of Indian medicinal plants. And the foremost name in this is that of a Portuguese governor called Garcia de Horta, who was placed in Ahmednagar, who was the chief physician of the governor with Nizam Shah I at Ahmednagar. He wrote a textbook which became very famous, and it was then translated into 22 different languages very soon. The textbook was initially written in Latin, and many other aspects were recorded in this, how medicinal practices are followed in India. For example, one of the myths that European had carried till that time, that tamarind grows on a palm tree, and he dismissed that particular myth and he records this in this particular book. This particular book also says that there was first recorded autopsy on a cholera victim. He also records that the botanical treatment for a snake bite is because of dhatura extracts. So these are the kind of things that are recorded in this text, and Garcia de Horta was essentially a pioneer to take Indian medical practices to the West in this form of this very extensive text. It was close to about 1530 or 1560 or something around that particular point of time. And as I said, the whole of West appreciated this particular thing and was translated in many Western languages. But another very useful example comes up, and many of you are aware of this particular example, is in the form of Hortus Mulbaricus document that was created by the Dutch governor at a particular point of time called Van Reed. So Van Reed was placed in Kerala, and in Kerala he was amused by the medical knowledge that existed and the use of herbal extracts in treating different health conditions. And he took help of one of the chief of the local traditional physicians, Itti Achyutan, and along with Itti Achyutan, he traversed entire Kerala on foot and collected many plants and recorded that very meticulously in Hortus Mulbaricus. This was the first ever attempt being made in the world to systematically categorize plants. Remember, the students of biology are aware of the Linnaeus classification that was published in 1753. Hortus Mulbaricus of Hendrik van Reed precedes that by a few decades. So, once again, Indian medical practices now were being documented by the Western people. But one of the most remarkable examples is that of the practice of variolation. Now, variolation is some form of vaccination. Many of you are aware, the modern vaccines, the narrative generated by the Western people was the first person to generate a vaccine was Edward Jenner in the year 1797. That's the narrative all of us have read in our textbooks. But the practice of variolation in India and in China has existed for at least 500 years before that. Now, what is variolation? Variolation essentially is to prevent the epidemics or the pandemics. A pandemic like what we saw very recently in form of COVID-19. But then, in the 15th and 16th century, one of the major problems was smallpox. And in fact, it is recorded by mid 17th century, smallpox had edged out bubonic plague as the leading cause of death worldwide. In 1721, there was a deadly outbreak of smallpox epidemic in England, and the doctors in England who had practiced Indian medical practices, who had studied Indian medical practices, they began inoculating on a similar basis what had been learned from India and China centuries earlier. And this was actually described once again in the Royal Society, Royal College of Surgeons in their thing. And one of the records is that by Robert Holt in 1730s, but a more detailed record is by J.Z. Holwell, who was one of the survivors of the Black Hole tragedy in Calcutta, but he made a presentation in 1767. This, mind you, this 30 years before Edward Jenner's vaccine. And in his presentation, he says that virulation was considerably less risky than contracting the disease naturally. The mortality rate, the people who died of virulated patients, was approximately 1 to 2%, as compared to 30% mortality rate those who had not received virulation by smallpox. So remember, those people who did not receive, about 30% of those people were dying of smallpox. Those who had received virulation, only 1 to 2% were dying of smallpox. More than that, virulation was less likely to result in common side effects such as blindness or serious disfiguration. If you are virulated, the side effects were less. And like naturally contracted smallpox, it conferred lifelong protection against the disease after the patient had recovered. And unfortunately, soon after Edward Jenner's vaccine in 1797, which was based on cowpox, that's where the conflicts between the East and the West began to arise. Because by then the East India Company had more or less set a firm foothold in India, and the Indian population was now being forcefully vaccinated with the Jenner vaccine, while the Indian academia or Indian physicians then, they said that we have practiced virulation for ages, for centuries, and why should we actually go for this kind of vaccination by Edward Jenner? So that was the first of the conflicts that arose, but later much more serious conflicts arose, as you are aware, with 1830s and all, when Macaulay started talking about something else. I would like to very quickly come to notable contributions from India in modern medicine. I will not take too much time, I will take less than 5 minutes about this. Because the narrative that was being generated was Indians were only snake charmers, Indians were only magicians, and Indians would treat people by magic rather than any rationality. There were many people who took up in Swadeshi spirit, in the nationalistic spirit, the correct narrative that had to be generated. And one of the foremost of the people who wanted to generate a correct narrative was none other than Acharya Prafulla Chandra Ray. And he was of course a chemist, and he wrote the very classical book which is available on Amazon even today. If you do Amazon and look for History of Hindu Chemistry, you will see that from the earliest times to the middle of the 16th century AD. And he writes in very detail about how chemistry was known, work of Nagarjuna and so on and so forth, how it was actually known in ancient India. And then he founded the Bengal Chemicals and Pharmaceutical Works in 1901 to promote Indian industry and promote Indian practice of medicine amongst people. But closer to today's time, one of the first clinical trials that was conducted in India was by Lieutenant Colonel Ramnath Chopra, who was funded by the Indian Research Fund Association for clinical applications of Sarpagandha in 1930. Now, Sarpagandha is an extract, reserpine is an extract from Sarpagandha plant, and through proper modern clinical trial, he showed that this is a very effective hypotensive. Hypotensive is the sense, those who have high blood pressure, if they take reserpine, the blood pressure comes down. And it so turned out, this was the first drug developed to treat hypertension ever, and approved by FDA in 1955. So in true sense, modern medicine had arrived with the work of Lieutenant Ramnath Chopra in India. Ramnath Chopra went ahead to write India's Drugs and Cosmetics Act in 1940s, and unfortunately he did not pursue further, and Reserpine then eventually was discontinued because of psycho effects of this particular drug. And those who studied this psycho effect of the drug, the foremost of them, Arvid Carlsen and Bernard Brody, who extensively studied the action of Reserpine, eventually got Nobel Prize for neurotransmission later. But another name that comes in mind is that of Upendranath Brahmachari, who studied drug to treat leishmania, and this was urea-stibamine in 1920, and with that, the death rate due to leishmania came down dramatically in West Bengal and in Bihar in those particular point of times. In the post-independent times, there are many names. I have just chosen only one example, that of Nagarajan, and I want to actually show he was one of the finest medicinal chemists in the Sibagagi Foundation in Mumbai, and he synthesized many compounds, and two of the compounds were shown are here 31 and 32 of what you see here, and this particular compound has recently been introduced in the treatment against TB, tuberculosis, all around the world. It is called protaminate. It was undergone clinical trials, and it's a fine example of the drug that was discovered in India and eventually made to the market all around the world. I don't want to take much more time. I just want to actually say the last one particular thing that I had mentioned earlier about cannabis. Now, cannabis is described in Atharva Ved as one of the 5 holy plants, right? To the 5 kingdoms of plants which Soma rules as Lord, we speak. And the 5 plants are Darba, hemp, barley, mighty power, may these deliver us the woo. Cannabis has been used in India for a long time, many centuries, by many different people. And it has fantastic pain-killing properties. Unfortunately, in 1985, India undercame tremendous pressure by US government to ban cultivation of cannabis, 1985. And then India actually banned cultivation of cannabis, and there also stopped research on cannabis, which was about to take off at that particular point of time. As it turns out today, 40 years later, many states in the US have lifted the ban on cannabis, and in India also we have started slowly lifting. Some states in India, especially Uttar Pradesh, Manipur and all, they are slowly lifting ban on cannabis. And I am very proud to say that while I was in Delhi at CSIR, we undertook one of the studies to clinical effect of vaporized cannabinoids on breast cancer genetic expression patterns in perioperative period. That is, for people who are terminally ill, to give them a very effective painkiller, and we believe that these cannabinoids actually will form very effective painkillers as against the painkillers that are given today. And we do hope that these results would be very useful for the coming times. I would like to end here. To summarize, I have said that India has had a rich tradition in biomedical practices. There is a very healthy exchange between the East and the West upon these practices, and a lot of knowledge was carried from here to the West. I give you an example of reconstructive rhinoplasty, but many other things actually were carried to the West from here. The conflict really began with the ascent of colonialism, that is in late 18th, early 19th century. And when the West actually started looking towards India in great disdain as their colony, and that's where the conflict began. And the arrogance of colonial powers, and I don't say much, but about later on the barbaric behavior of the colonial powers essentially suppressed the knowledge that has existed in India for a long time. Today, both the West and the East have much to learn and gain from each other. And in this particular manner, the World Health Organization has recently announced setting up a global center for traditional medicine in Jamnagar. I believe that's a very welcome step. I do believe that if we go back to our roots and try to understand the practices that have existed in India, which have essentially arisen out of observations and practices on different people, on human beings. I think we have much to learn, and we can improve human health in the coming time with that. I would like to thank all of you. I would also like to thank Dr. Anand Deshpande and Department of Science and Technology for supporting me in Savitribai Phule Pune University and the National Center of Cell Science in Pune. Thank you all very much once again for patiently listening to me.